Conversation between a doctor and a patient about an eye infection.
Good morning, doctor.
Good morning. What brings you here today?
I'm having trouble with my eyes. They have been itchy, sore and watery since last night. I think they are a little bit swollen too.
Let me take a look. Your eyes are indeed swollen and red too. Did you scratch them?
I did scratch them because they were itchy.
You should never scratch your eyes with your hands, as it is possible that you might transfer germs to your eyes. Whenever you feel itchy or sore, always wash them with cold water.
I did wash them with water. And also put some saline eye drops. But all of that was in vain. The itch won't go away. It has even started to pain.
This looks like an eye infection. Many people are having it owing to the weather change. I'll put some eye drops for now. And we'll also prescribe the eye drops for later use.
Please give me something that will give me instant relief. I wasn't able to sleep last night because of the pain.
Here, open your eyes so I can put the drops. Remember, do not scratch your eye with your hands or any cloth. Use the drops at least 4 to 5 times a day. And keep washing your eyes with cold water. If you do not get any relief, visit me tomorrow.
Thank you, doctor. Hopefully, I will not have to revisit you.
Conversation between a doctor and the patient after surgery. Hello, welcome back. I did not think I would need to see you again.
Yes, doctor, me neither.
Tell me, how are you feeling after the surgery?
I feel terrible, my entire body is aching, and I can't stop shivering. My vision is blurry, my mouth is dry, and I feel fragile and dizzy when I get out of the bed.
To be expected after a severe operation.
I know, but I get so warm that I feel like I am burning up, and recently my body feels itchy.
You have a fever or maybe an infection. Describe exactly where you are aching the most.
I think my back and legs hurt the most, they are throbbing, and I think they are also swollen.
Okay, I'm going to check your temperature and your pulse. You may need an antibiotic if you have an infection.
Can you give me something for the pain? My whole body is sore, and my head is aching too.
Your temperature seems fine, so you don't have any fever. I will prescribe you some painkillers, for now, but I think this is just a post-surgery pain.
Thank you. I hope the pain goes away fast.
Conversation between a doctor and a patient about severe stomach pain.
Good evening, doctor.
Good evening. Please sit down.
I've got a stomach ache, doctor.
I see. What do you feel?
I have got sharp pain and heartburn.
How long have you had this pain and acidity?
For 2 days now. It does not go away. I eat, and after every meal, my stomach hurts. At night the pain seems to double up.
Is the pain continuous, or does it come and go occasionally?
It comes and goes. It hurts me the most after every meal. Other times, the pain isn't that severe.
Is there any kind of food that affects you?
Greasy ones and food which has got coconut milk in it.
Okay, and where in the abdomen does it hurt? Does the pain travel to your chest or shoulder?
It hurts in the middle. Sometimes, the pain travels across my abdomen.
You said you have heartburn besides the pain too, right?
Yes, doctor. After a burp, I feel a kind of sour taste.
Have you noticed any change in the consistency of your bowel movement? By any chance, have you noticed blood or a color change?
It is a bit softer and slightly greenish. I did not see any blood in my bowel movement.
All right. I will examine your feces to check if there is any kind of parasite. I would also like to examine your upper gastrointestinal system through X-rays and contrast. It is effortless. You will have to drink a thick substance, and the radiologist will see how you digest the substance. They will see the movement of your stomach. I have let the staff know about your X-ray. Please follow him. Do you have any questions before that?
With so many medical tests, I was wondering if I have an ulcer.
We need to think of that too. That is why I want that test. An X-ray of the upper intestine sometimes cannot detect an ulcer or other irritation. If the pain persists after some antibiotics, you will need an endoscopy. Any other questions?
No, doctor, thank you very much.
Good. Get your X-ray done immediately since we have a vacancy now. And visit me as soon as you get your reports. Goodbye.
Goodbye, doctor. I will see you soon.
Conversation between a doctor and a patient about sudden chest pain. Hello, what seems to be the problem?
I have chest pain.
How did the pain begin? What were you doing?
I was resting, and suddenly felt a stinging sensation around my chest region.
Did you work out before? Almost half of the ischemic conditions occur after physical activity, emotional stress, or after consumption of alcoholic beverages.
No, doctor, I did not work out or consume any alcoholic beverage.
Have you previously ever had the same sort of pain?
No, I have not.
Can you please describe the pain and how long has it been bothering you?
My chest feels constricted as if I am drowning. It has been approximately 30 minutes since I felt the pain. Sometimes it is a stabbing pain, other times it subsides, and begins anew.
Tell me, exactly where it hurts?
It's on my sternum, then it expands on both sides of my chest, mostly on the left side.
Have you used any medication?
Nitroglycerin, but I don't think it had any effect.
Do you have any other problems? You appear very pale to me right now.
I have a hard time catching my breath sometimes, feels like I am choking.
I will prescribe you some medicines for temporary relief. But I recommend you to get an ECG done, and visit me immediately.
Thank you, doctor. I will soon visit you with my ECG reports.